Hi friends, this is our module 4 quiz 4.9. We're going to match our different definitions. So it is important for daycare to understand what we are doing for cleaning. And so question number 1, clean is just to simply remove that physical dirt. Okay. When we sanitize, we really need to apply something that is going to make germs at a safer level. So that is a second level. The third level then, which is what we need to do, is to disinfect. And this destroys all germs when applied to that hard, non-porous surface. So when you're looking at what to do in terms of safety and cleaning, sanitizing or disinfecting, there's rules by the county regarding which we have to do and how often. So essential components to maintaining a clean and well-organized childcare environment are policies and procedures surrounding all of the following. Except, so we're going to mark the one that is except. There are rules for hand washing, regular toy washing, and cleaning up accidents, especially those bodily fluids, but not on that hourly or weekly fees. So we have hourly or weekly fees here. Question number 3, which is the most common dangerous mistake that people use for their car seats? And that's really for the straps to not be too loose on that child. Now, question number 4. Children in the U.S. have less healthy today because of all of the following. So we talk a little bit about the fact that they are less healthy because we have huge portion sizes here in the United States. Our stuff is more processed and high fat. Children are not as active as they used to be, but we want them to spend time with their families. That has nothing to do with their health. Does less fat always mean less calories? And the answer is false. That is not true. So we need to watch that as we're reading labels about health and nutrition. Question number 6, we want to mark all the following conditions that require immediate medical attention, and therefore that we would call 911. So if a child has a fever or severe headache or stiff neck, and the child can't touch the chest, that could be a sign of meningitis. Indeed, we need to call 911 right away. Just because they have a fever or airplane, we're not going to call 911. If they ever have a fever and difficulty breathing, we are definitely going to call 911. If a child has a cut that might need stitches, then they can have their parent take them to the hospital. They don't need to be called 911. If they are blue, purple, or gray, their lips, then they are out of air. In that case, we're definitely calling 911. And after a blow to the head, and the child is nauseous and confused, and the child could have a concussion, those are all reasons that supersede our lack of medical attention. We need to call 911 right away, have the child taken. Now, when we're reading those food labels, we need to pay attention to really all of the above. We're looking for calories, serving size, to be able to see total number of calories, as well as how much, what ingredients there are, sugar content, salt content, fat content. So mark all the categories of activities to include in the daily schedule of a family home childcare. In this next upcoming unit, you're needing to make that daily schedule. And as you can see, you need to have nap time, meal time, circle time, and also some free play time that is included in that. A daily schedule is beneficial for so many reasons, including easing transitions, including having communication between parents and child givers, including things making time go more smoothly. But a daily schedule is adapted to the specific needs of the individual child. Posting a daily schedule, we can adapt it, but to the needs, but that's not why we put together a daily schedule. Giving a warning when we're looking at discipline or managing behavior, such as a schedule that includes 2 minutes until cleanup time. It eases transition for children. Is that true or false? And it absolutely does. That's part of our schedule. In fact, when you make your schedule, you're going to need to have something similar to that in your schedule. It's the reason why we have a schedule in 10 to 15 increment. 10 to sometime not more than 20 minutes of time. Now, question 11. A list of community resources for families in need might include a telephone numbers of, we're not going to have, family resources can be anything that causes challenges for that family. We want them to get help on their own. So any of those will count. I'm going to mark the steps for a daily health check. So we're going to make sure that everyone is safe and healthy in our care. So we want to make sure that there is no pink eye. We want to make sure that we're listening so that there's no coughing that could be spread. We're going to look and see if the child is ill and perhaps smells like vomit, that they vomited before and the parent cleaned them up and just brought them to school, or if they have a fever. All of those would be reasons for the child to go home. Because they are contagious. So that's what we are looking for. Question number 13. What is the recommended order and procedure for children who become ill as a child at school? So we're thinking that we're always going to isolate that child first so that they're not getting any other children sick. Then we'll call the parents. We'll be watching the child, right? We're not going to leave them alone isolated. We still need to watch the child. And we're going to document your actions, noting that what you did for and with the child as well. Okay. There we go. Alrighty, so question number 14. A child may be admitted to a child care if a parent signs a waiver saying that the child is not immunized because it's against their religious beliefs. Now, is that true or false nowadays? As actually false. So they changed that law back in 2016. They made a law that you are no longer allowed for personal or religious beliefs to not have your child immunized from preschool or in California, preschool or K through 12 school. So they have to be immunized. Mark all of the following that are required immunizations for children. And so these are the required ones from the state of California. It's going to be polio. We don't immunize for tuberculosis in this country. We do immunize for chicken pox, for measles, and for diphtheria, DDP. There is a flu vaccine, however, it's not a required immunization as of yet for children to go to school. What's the best way to prevent that spread of disease? We're really looking at washing our hands for that 2-minute time with soap. So this is what we want. We obviously are wanting to taking a bath. Yeah, we just have to wash. It's according to the CDCP. Question number 17. At what age can you start giving cows milk? So this is a nutrition section. And we still, as of yet, it is hard to digest cow's milk, and therefore we say not until the age of 12 months old. Toddlers and preschoolers must be served milk at breakfast, lunch, snack, and dinner. This is true if you are running a daycare that has federal funding. And the answer is actually false. You're only required to serve milk at breakfast, lunch, and dinner. So at snack time, you can have water. So it's only milk those 3 times. Infants should always be fed on a strict schedule. Is this true or false? And the answer is false. Even though the majority of children tend to like a schedule, it's not required to feed them on that strict schedule. At times, if there's medical reasons from the pediatrician, if the child is required to, then that would be then you would have to have that protocol, but that would be something you would know ahead of time. Now, the benefits of individualized care routine includes all of the following except. So we're going to mark the except one. So an individualized care routine is one where a child can learn that she is valued. So that's true. We're going to look that the child is part of a greater community, and that is true too. When you individualize your care routine, you're also building a relationship with the caregiver. Now, if a child can learn that she will not get sick so often, that one is just not true and not related, not one of the benefits of that we're looking at for that individualized care routine. So thanks so much. We did all of our questions for our 4.9 quiz. Thanks.